Hi guys, my name is Dr. Mona Hardas. I'm a board certified OBGYN. I'm a cosmetic gynecologist, a minimally invasive surgeon, an author, as well as a social media educator. In today's video, I wanted to talk about the treatment options for low libido. Now, in my last video, we talked about what is a low libido and why it happens. So if you haven't watched that, I urge you, please go and watch that video first before you continue with this. Because in this, we're going to talk about different things that can be done to help you with the low libido. Now, to recap a little bit, low libido is because of variety of different reasons. It could be psychological stress, depression, relationship problems. It could be physical issues like vaginismus, fibroids, endometriosis, vaginal septum. It could be because of the perimenopause, menopause. It could be because of certain chronic medical conditions and medications given for it. So there are so many different reasons for this. So to come to a diagnosis, please see a gynecologist. Talk to them, have an open and a really honest conversation, because it's really important for them to know what is your normal libido. Some people just have low libido all their life. They don't really need treatment as their normal. But what is the normal frequency of sexual intercourse, or used to be? How much it has decreased? What has happened? What has changed? Are there any life changes? You've gone through pregnancy, perimenopause, menopause, a relationship problem? Is there anything which is going on which can kind of lead to this symptom? Your doctor also needs to know if it is causing distress, how bad it is. Please let them know if it is, because there are treatments available. So your doctor will do a thorough physical examination and a history taking. Really important with the history, like I told you, they need to know information about you. They need to know, do you have any chronic medical conditions? Are you on any medications? Have you had any bad experiences in life? Are there any stressors in your life? A lot of questionnaires are out there to check you for depression, to check was there any reason or any psychological reason for low libido. So after the history taking is done, they will do a physical examination. Physical examination is important because I told you there are certain conditions like fibroids, endometriosis, ovarian cysts, prolapse. There are so many medical conditions which can cause pain and lead to low libido. You may have had an episiotomy in the past and the scar is painful, and that's why there is a pain, and that can be done. An episiotomy scar can be reversed. If the vagina is too tight, and that's why there is pain, again there are procedures that can be done. Vaginal dilators can be used. They play a very important part, especially in women who are in perimenopause, menopause, and vagina is very tight. We can teach you how to use the dilator to help you stretch the vagina so it's not as painful. Maybe you have a vaginal septum. Maybe there's a hymen is too tight. You're young and you just got sexually active and it's been painful from day one. Really important to see your doctor to see if that's the reason, because that can be treated very easily too. That's what we do as a cosmetic gynecologist. We do all this procedure and help you with that. So please, examination is really important. Examination is also important in a perimenopause when there's a lack of estrogen. If it's a lack of estrogen, the vagina, the lining looks thinner, the color is different, is very tight. The muscles of your pelvic wall, we call levator muscles, are very tight and tender, and we can do something about it. Nowadays we use Botox injection if the levator muscles are very tight, to relax them, so that way it's not painful. So after the examination, your doctor is gonna come up to see with the diagnosis to pinpoint what is the cause. Now, it's not always like one cause and we can go after it. It's kind of a multiple things can be happening at the same time, and all that can be treated. Now, if you are young and premenopausal, so that is before menopause, there are two medications on the market for you for a low sexual drive. One is called Addy, and what Addy does that, it's Addy is an oral medication. You take it daily. Take it in the evening or at bedtime. Do not try to drive or do things after you have taken Addy, because one of the side effects of Addy is that it can make you tired, dizzy, fatigued, kind of sleepy as well. So take it at night time. You have to take it at least for 8 weeks before you see if it is working or not. And how effective it is, I would say about 54 to 56% women say that it does help. Addy has got certain contraindications. If you are drinking alcohol, then do not take this medication, because alcohol and this medication combination can decrease your blood pressure. You can become hypotensive, get dizzy, and fall. If you had had a drink of alcohol, there should be at least 6 hours between that alcohol drink and taking Addy. If not, just skip the dose. If you have had more than 2 drinks, don't take it that day. So really important to remember the interaction between Addy and alcohol. You need to see your doctor and be monitored for this medication. But again, as I said, you have to use it 8 weeks before you know it. So this is an oral medication. There is an injectable medication called YSC. YSC is a subcutaneous injection. We can teach you how to give it to yourself. You give it about 45 minutes or so before sex. Okay? So if you're planning to have sex that day, take it 45 minutes before. Side effect, again, some nausea, stomach upset, it can do that. The biggest contraindication for YSC is high blood pressure. If you have high blood pressure, if you are on medications for high blood pressure, or if you have any heart problem, any cardiovascular problem, you should not be using this medication. So important to remind your doctor about that. Mention the medications you are on. And again, effectiveness is about 54-55% or so. So nothing like amazing, but at least there is something, right, which is out there to help you out. People have used testosterone supplements in the form of pellets or creams or lotions. They help in some women who have low testosterone. So your doctor might do a testosterone level, see if you need that. It has to be monitored very, very carefully. Just because, number one, it's not FDA approved. Number two, the dose has to be small enough that it won't have side effects, but enough that it is giving you some benefits. Now, the side effects of testosterone in a long term, it can increase your cholesterol levels. It can increase facial hair growth. It can decrease your scalp hair. We call it a male pattern baldness. And it can cause clitoromegaly, that means increased size of the clitoris. And in very high dosages, it can change your voice. So lots of bad side effects which are permanent, cannot be changed. So the testosterone supplements, though they have shown some effectiveness, they come with a lot of risks. So again, has to be given to you by a trained professional, a physician, who can help you manage the right dosages. Now, estrogen supplementation, especially in a perimenopause and a menopause age, is very important, because estrogen is associated with increased sensitivity, increased elasticity of the tissue, as well as increased desire and lubrication. So estrogen can be used in a different forms we call hormone replacement therapy, and again that you can talk to a gynecologist about it. You can take oral estrogen, you can take transdermal or in a patch form. There are lotions and sprays available. There is a vaginal ring, and there are just the vaginal preparations for a person who doesn't want to be in a full hormone replacement therapy, can just use a vaginal estrogen, which will help as well. The anti-anxiety, anti-depression medication help out as well as sex therapy and counseling plays a huge role. The problem is finding the right therapist, right? It depends upon where you live. Are they available and are they good? Those who are good are very busy, so it's really hard to get into them. But if you can find a good therapist, they can teach you about what is normal anatomy, what do you like, so they can help in a couples counseling, help your partner, help you reach there so that you're actually enjoying sex and would want more. So sex therapy, cognitive therapy, breathing exercises, meditation all play a role and can be taught to you or given to you by the right kind of a therapist. We also have something called a O shot. In O shot, what we do is that we use something called PRP, or a platelet-rich plasma. Now, this platelet-rich plasma has growth factors in it, and we actually eject it in under obviously with anesthesia, your numb in your clitoral area and in your G-spot area. That helps stimulate the growth of the tissue as well as increase sensitivity. It has been very popular in my practice, and people swear by it because it does work. There's no medication, it's your own blood we are using. So there are a variety of different treatment options out there. We can tailor-make the treatment option depending upon what is the cause of decreased libido. So please see a gynecologist, call me, leave any comments or questions below, call my office, let's sit down and see what works the best for you.